Thank you, Madam Chair and committee members. I'm here today presenting the Alex Smith Insulin Affordability Act.
And Representative Howard, if you can move the bill and put it properly before us if you would like. And
yes, I'm a little out of practice.
We all are.
I would like to move House File 3100 and make a motion to refer it to HHS policy.
Excellent. Thank you.
Right now, as we speak, Minnesotans with type 1 diabetes are asking questions that many of us find difficult to comprehend. And should I buy groceries or afford my medication? You know, what if I take a half dose today? Can I make it to my next paycheck? What happens if I lose my job and my health insurance? Will I lose my life as well? This is the reality for thousands of our friends, neighbors, and family members, and we have the power to do something about it. And that's what we can do by passing the Alex Smith Insulin Affordability Act. This committee heard Alex's bill last year, and it passed the House. As you know, it didn't ultimately pass the Senate. A bipartisan group of legislators have worked on this bill really since session adjourned. And this bill is the product of a lot of that work with good ideas from both Democrats and Republicans to build a bill that meets 4 standards that we set forth on a bipartisan basis, which is that we need to address the emergency issue facing Minnesotans that can't afford their insulin they need to survive. We need to address the long-term care challenges facing insulin and patients and affordability. We need to set up a program quickly because time is of the essence, and we need to ensure that pharmaceutical companies contribute to the solution. That's the kind of solution we have here today. And in broad strokes, I want to walk through it. We are creating a program that provides a path to Minnesotans most in need or could be at risk of rationing their insulin, a path to get a fill of their insulin in the pharmacy when they need it. And vitally important, we ensure that access happens at the pharmacy, utilizing the existing network and delivery method that works best for patients. We are also connecting patients to a long-term solution through a navigator and MNsure. We want to make sure that Minnesotans have an opportunity to get on to health plans that might cover insulin at an affordable rate. And if not, we want to square them away with a path to get a supply of insulin so that it's affordable for them. In addition, this bill includes a cap on insulin copays at $30. One thing that's happened since session adjourned, 4 of the large health plans in Minnesota have stepped up, and I'm grateful that they have. They've capped at insulin copays for $25 and under for folks on their plan, and that includes a subset of Minnesotans. And since the goal of our long-term program is to get folks onto that long-term coverage, we want to set in statute a cap of $30 for Minnesotans to continue to have that guaranteed affordable coverage. Those eligible, as I mentioned, are those most at risk. The uninsured, folks that are underinsured and have huge out-of-pocket costs for their insulin, and Minnesotans on Medicare that have large out-of-pocket costs. And in terms of funding, this bill is funded through a combination of public dollars to largely set this program up and get it running, and a fee assessed on 3 insulin manufacturers. Keep in mind, virtually the entire supply of insulin in this country is controlled by 3 insulin manufacturers that did $80 billion in business last year with profits of over $20 billion. And this fee would simply ask a fraction of a fraction for those companies to contribute towards a solution and ensure that Minnesotans have access to affordable insulin. This program is ready to go. We've worked with a broad group of stakeholders, pharmacists, doctors, patients especially, and built a program that we believe can get up and running quickly. We would expedite this process by using a third-party administrator to administer a program in a way that they're already currently doing, processing claims for pharmacists, so that we have a program that works for pharmacists, works for doctors, and like I said, most importantly, works for patients. It should not be lost on us that had we passed Alec's bill in the 2019 session, it would be the law of the land. Minnesotans contemplating those gut-wrenching questions I mentioned would have Alec's law as a safety net when they need it most. And it's important to call out that since the legislative session adjourned, we've lost Minnesotans. Jessamiah David Scherer, 21 years old, from St. Louis Park, Minnesota, lost his life rationing his insulin. We know of another Minnesotan who chooses not to be identified that lost their life. This is deadly serious. And we have the power to take action, and we simply cannot lose another Minnesotan on our watch.